Hello everyone, a very warm welcome to our new edition of Dental Video Magazine. We're starting our show today with information for your patients on the advantages of intraligamentous anesthesia. This new information will be useful to you if you decide after our second item to make more frequent use of the intraligamentous anesthesia method. Your patients would certainly thank you for it. Our show begins with the DVM information for patients on the topic of intraligamentous anesthesia.
One can hardly imagine what it must have been like when there were no pain-suppressing substances available. A few paintings from earlier times hang in the German Museum of Dentistry in Cologne and bear witness to the torture suffered during dental treatment in the full knowledge that the treatment usually meant the complete loss of the tooth. Even today, some people get into a real panic before the dentist even reaches for the syringe. Yet only in the rarest cases is treatment possible without local pain suppression. That's because every tooth is connected to the extensive nervous system that runs through the whole body. If a strong stimulus is exerted on one of our limbs, our skin, or on a tooth, the nerves send out electrical currents which release the pain sensation in the brain. Up until now, in order to suppress the message-sending ability of the nerve in a tooth, an anesthetic solution has been injected into the corresponding region of the jaw. In the mandible, an entire half of the jaw has been anesthetized for 1 or 2 hours with this method. It doesn't have to be like that, because there is a new syringe which requires the needle to be inserted to a depth of only 3 millimeters into the gap between gum and tooth. The needle is only 0.3 millimeters thin, scarcely more than a woman's hair. And it is only 3 centimeters long. That is entirely adequate because it doesn't need to be injected as deeply as before into the soft tissue of the mouth. With this method, 0.2 milliliters of pain-suppressing medication is sufficient to block the nerve. The solution is injected very slowly and gently. At the same time, this intraligamentous anesthesia is every bit as effective as the previous type of injection, but it has the advantage of being over at the same time as the treatment. You can immediately speak normally or have something to drink. The numb feeling that sometimes lasted a very long time is a thing of the past, and you hardly feel the prick from the syringe.
As a method, intraligamentous anesthesia has been well known for many years. Of the estimated 100,000 syringes purchased for this method, most are probably never used. This needs to change. Not only can this anesthesia method be used for virtually all applications, but it is also, when used correctly, extremely patient-friendly. That's why we're tackling this issue. Dr. Werner Betz, a dentist at the dental clinic at Frankfurt-Main University, and Lothar Taubenheim, co-author of a book on intraligamentous anesthesia published by Thieme, have assisted us in preparing this segment. You'll see that intraligamentous anesthesia not only offers benefits in treatment, but can also be much more pleasant for the patient than, say, the traditional nerve block anesthesia. Perhaps our report will even prompt you to use this advantageous and patient-friendly method more frequently, for as you well know, gentle treatment is the best marketing concept of all. Our thanks go to Dr. Werner Betz of Frankfurt University for his clinical demonstration.
The soft-jet syringe with dosing wheel, manufactured by instrument specialist Henke Saas Wolf, Tuttlingen. During intraligamentous anesthesia, the needle is inserted in the sulcus near the tooth neck to a depth of about 3 millimeters. The syringe is supported on the finger, ensuring a secure, comfortable grip. Injecting is done very slowly, taking 20 seconds for 0.2 milliliters. This is only done on the tooth to be treated. There is thus no collateral numbness. The anesthetic spreads through the periodontal ligament and, to a greater extent, within the bone. It is then carried through the blood vessels to the pulp. The anesthetic takes immediate effect. Treatment can begin at once. The duration of the anesthesia is brief. It wears off within 30 minutes. The possible injection points for intraligamental injections are shown here for the maxilla and here for the mandible. The entry points for the needle are always directly below the neck of the tooth and are determined by the anatomy and morphology of the periodontal ligament. And now to the soft-jet syringe with dosing wheel. A drop of anesthetic is just being applied to the free gingiva. The anesthetic applied to the free gingiva has an immediate anesthetic effect on the surface at the injection point. Accordingly, there is no more injection pain. The pressure must be reduced before the needle is removed. With this syringe, the permitted amount of anesthetic solution is released by means of a dosing wheel. Turning the dosing wheel 3 times over 5 slots releases exactly 0.1 milliliters of solution. This can be managed very easily with the marking lines. 0.1 milliliters is required twice for each root. To avoid the undesired effects of a feeling of elongation and pressure pain when sensation returns, it is essential to administer the anesthetic very slowly. A consistent maximum of 0.2 milliliters of anesthetic solution is to be injected for each root. For the first root, 0.2 milliliters anesthesia solution may be injected in about 20 seconds. For the second root, the injecting time will be somewhat longer. And for the third root, 25 seconds are right. Even 0.6 milliliters are not a lot when compared with a whole cylindrical ampule. However, it is a considerable volume of liquid if it has to be pumped into a space that is already full. Injecting too quickly can result in an expansion of the alveolar compartment, which causes the undesired effects. Intraligamentous anesthesia can be used for practically all applications with the exception of larger-scale surgical procedures such as implant insertions. Intraligamentous anesthesia has proven especially popular with children who accept the small needle and the fountain pen appearance of this syringe more readily than a standard syringe. By the end of the session, whether it be preparation, a root canal treatment or an extraction, the intraligamentous anesthesia has worn off. The patient is free to immediately carry on again with his or her professional, social or private duties and pastimes.